Good afternoon. We are with Marie Baldisseri, Professor of Critical Care Medicine and Neurocritical Care, University of Pittsburgh Medical Center, Pennsylvania, United States. Thank you so much to stay with us.
Thank you for the invitation.
Thank you. Intensive care medicine is a new specialty. Why you have decided to work in the field of critical care? Thanks.
Intensive care medicine has been around a little longer than you think. Under the auspices of Dr. Aki Grenvik and Peter Saffer, I did my training, and both of these individuals were what we would consider the grandfathers of critical care medicine. So I was very blessed in my training to be with them, to know them, to learn from them, and to be part of that first or second generation of critical care medicine. Why did I want to go into critical care? Because to me, it was the most exciting field of medicine. It included logical thinking, skill set with procedures. You could actually act like a detective to sort of figure out what was wrong with the most critically ill patient. It was a blend of surgery and medicine and anesthesia. It was the perfect field. It is the perfect field.
Well, what would you like to change in your job in order to improve the work-life balance?
Sorry, Sophia, you're frozen.
Yes, I froze. No, okay. My question was, what would you like to change in your job in order to improve the work-life balance?
Well, I think now I have a good work-life balance, but when I began my career, it was very difficult. I had 3 children, a husband who also was a physician and became chief of a department. So the balance with work and life and children was very difficult. I must say that because of our schedules, that I was the one who had to relinquish some of the activities I could have had. That is, advancing in my department, becoming vice president or vice chair. It was difficult. It was almost impossible for the 2 of us to have full-time schedules. We did it with difficulty. It would have been better if my department could have been more, how should I say, more understanding, since I was the only woman in the department. But I must say that over time, this changed. As the only woman in my department, I began to demand certain things, such as the ability to go part-time. And that was very important to me. And no one in my department had ever done that. But I set the precedent for the people in my department, because now there are women who are part-time and there are men who are part-time. We have to recognize that many men also function in the home. They take care of the children. They want to stay at home with their families. So I'm very proud of that over time, I was able to change the milieu or change the environment in our department. But I have to say it wasn't easy.
Okay, fantastic. Are there challenges in combining being a woman and a frontline doctor?
Well, I think yes. There's a certain stigma that happens with women. If we are seen as very aggressive, where often called difficult or aggressive. Whereas I work as a surgical intensivist, I work with mostly men. And if men is seen as aggressive, they don't use that term. You know, it's they just want what they know what they want, or they're being advocates for their patients. Now, I think over time, at least in my institution, that's changed. But for many years, I was seen as someone who was very aggressive, who would speak her mind, who would argue with people. My husband could attest to that. I love arguing. But I was seen as someone, albeit a bit difficult. I think it's different now. I'm seen as someone who is the patient's advocate. But I think that young women and mid-level practitioners still have to work under that bias, whereas men can speak their minds, but women need to be a little bit careful about how aggressively we speak our minds.
Okay. Have you ever experienced discrimination in the workplace or anywhere else?
Well, I think if you speak to any woman, she would say that she has experienced some discrimination. Certainly early in my career, when I was very young and shy and not so aggressive, I experienced quite a bit of discrimination, particularly not so much from the people I work with, not my colleagues in critical care, but from many of the surgeons I worked with, because at that time, back in the 1990s, 2000, there weren't as many women in our fields of surgery and critical care. And no, things were said to me that were outrageous. You know, you should be at home with your kids instead of working here. That would never occur now. I would never allow it. And I think as a whole, perhaps people have changed to some degree, not completely. I think with the younger physicians and surgeons who are now coming into medicine and surgery, I believe that there is more of an acceptance of women, and we are part of the workforce. But years ago, not so long ago, that wasn't the case, unfortunately. I think one has to feel, and Dr. Rubilato would agree with me, one has to feel very comfortable in your expertise. You know, I had to recognize that I wasn't talking as a woman, I was talking as an intensivist, as a skilled intensivist with many years of experience. And when I moved into that sort of mode of thinking, I became much more confident. You know, you can talk to me as a woman if you choose to, but I will talk to you as an attending, as a skilled intensivist, as someone who has many more years of experience. And I think once women have that level of expertise, but it's unfair that at the beginning of their careers, they may find some bias. And I still think that bias exists.
Good. You have achieved top results in your career. You are international, well known as a successful woman. Would you like to give some advice to other women in order to achieve the same results?
Well, as Dr. Rubilato will tell you, the most important thing for women, and I think men also, is that you find a mentor or a sponsor, someone who not only is willing to give you advice, but who is willing to say, I can't go to this lecture, or there's a conference in, you know, Rome, Italy, or there's a conference in Nebraska. And I think you would be a very good speaker for this, because we have to promote our junior faculty and our mid-level faculty. As Francesca will tell you, we have given many lectures. We don't need to give any more lectures or write more book chapters or write more books. Our job, once we become mid-level practitioners and senior practitioners, is to sponsor and mentor young women. And, unfortunately, because of my generation, there were few women who sponsored or mentored me, but I was very lucky that there were many individual men, professors, who did sponsor me. Otherwise, I don't think I would be in the position I am now. So we can't exclusively say, find a woman sponsor or mentor. The most important thing is to find people who will support you regardless of their gender.
Well, in your opinion, what opportunities can the iWIN platform offer for young women who are pursuing a career in medicine? What they can do in order to achieve their goals? Thank you.
So I think that you have to be forward thinking. You have to be somewhat aggressive in the pursuit of your expectations. You simply can't sit back and say, come to me and ask me to be, a speaker, ask me to do this. You have to, in every field of medicine and surgery, you have to prove yourself. And how do you prove yourself? You prove yourself by very hard work and initiation. So becoming part of an international society, such as the Society of Critical Care Medicine or the International Women in Intensive Care and Critical Care Network. Become part of a professional society. Surround yourself with people with like ideas, with similar ideas, who will help you, but who are also expecting you to do the work. So as a junior faculty, as a mid-level practitioner, you are expected to write the book chapters and to volunteer for the task force and the committees, because that is how you will relate to your faculty. That's how you relate to your colleagues. And that's how you advance your career. You have to put the work into it. There's no other way.
Okay. Thank you so much. Thank you. Really, thank you.
Marie, thank you so much. And
Grazie.
I'm waiting for you. You are leading the workshop of leadership by role models. I met you a couple of years ago, and I have no shame, but I'm only proud to say that you've been for me a role model all the way. Not just because, but
we've had a great relationship over the years. It's wonderful that we can reconnect.
Thank you so much, and I hope people will meet you and us and I feel empowered by talking to you and see what you've done with your life and how you achieved it. So
well, you should be speaking as well, because you've done just as much. So all right, Francesca, do you want to call me on the phone?
Yeah.
Okay. All right, Sophia, thank you.
Bye bye. Thank you so much. Bye bye.
Bye bye.